The second form of therapy I chose to examine was cognitive behavioral therapy. Drake describes this as a form of therapy that addresses both an individual's cognitive and behavioral patterns and how the individual can learn healthier coping mechanisms to deal with symptoms while also changing the individual's thinking pattern to better grasp reality and lead more effective lives. Kingdon described this form of therapy as on an average occurring in 12 to 20 sessions, depending on the individual's needs, while also using the ABC model. So the image on the right really helps me to describe this in an organized way. So the patient is asked to examine a negative event that had happened to them, as well as their beliefs surrounding the event as to why they happened and the consequences that happen afterwards. So typically a person goes in with an irrational belief or a negative belief about something negative that happened to them. And what cognitive behavioral therapy does, it helps individuals to cope and manage with their positive symptoms they experience while also addressing negative symptoms, psychological distress, and functional outcome. So the ABC model helps individuals from taking these irrational beliefs and learning to understand them in a rational way and have a healthy outlook on the consequence afterwards instead of having an unhealthy outlook, which can cause their symptoms to get worse and leave them worse off. So the mechanism of action for cognitive behavioral therapy can be divided into 3 categories. I'm going to start off with the cognitive. Some of these patterns of change that are seen in this are restructuring maladaptive thought patterns, changes in focus, and developing adaptive coping thoughts. Some things that happen in the behavioral category include habituation and stopping maladaptive behaviors. And in the psychological category, normalizing arousal, habituation, and changes in the automatic nervous system activity.